All right, so now we're going to talk about the innervation pathways of the sympathetic and parasympathetic sides of the nervous system. We're also going to talk about adrenergic and cholinergic neurons as well as their receptors. So these two pathways, again, are just a 2-neuron series. That's it. So we have one that starts in the central nervous system and makes its way down through the spinal cord and joins up in a ganglion. And then the postganglionic neuron, right, is going to have the cell body in that neuron, in that ganglion, and is going to then the axon is going to stretch all the way to the effector. So this is just a 2-neuron chain, right? That's it for this. The preganglionic neuron and the postganglionic neuron, and then of course where they come together is the ganglion, where the cell body for the postganglionic neuron is found. In this case, we're looking at a couple neurotransmitters. We're looking at acetylcholine and norepinephrine or epinephrine. So norepinephrine, epinephrine are sympathetic. They're going to kick that on. Acetylcholine is going to be for the parasympathetic or the rest and digest side. That's why, if you remember looking back, we talked about neurotransmitters. We talked about how acetylcholine can be excitatory and inhibitory, right? Kind of can go both ways. So preganglionic neuron, this is the neuron that comes from the central nervous system and extends all the way out. This one is going to release acetylcholine at the synapse. And then the postganglionic neuron, the one that is going to connect us to the actual effector, this one is going to release acetylcholine or norepinephrine, epinephrine. And that just depends on, are we going sympathetic or parasympathetic? Do we want to excite something? Do we want to inhibit something? Right? That's just going to depend. So let's take a peek, right, of how, like, some examples, right? So here we see right here we see the preganglionic neuron coming down, right, through the motor neuron. We meet up at the autonomic ganglion, we release acetylcholine, and then here we have the postganglionic neuron reaching out to the effector. In this case, we're looking at like the bladder, the heart, right? We're looking at all sorts of glands that are going to be touched by that. And then at the very end, we're going to be releasing norepinephrine. Over here, right, we have our 1 reaching down from the spinal cord, right, our preganglionic neuron reaching down to the adrenal medulla, and this is going to talk to the chromaffin cells to release epinephrine and norepinephrine. Still using acetylcholine to talk to from the preganglionic neuron to the adrenal medulla. And then the parasympathetic side here, again, just a 2-neuron series again. We have our preganglionic neuron coming down, joining up at the autonomic ganglion, releasing acetylcholine, and then the parasympathetic postganglionic neuron is going to reach out to the effector and release acetylcholine. So these neurons are classified based on neurotransmitters they produce and release. Adrenergic are going to release noradrenaline or norepinephrine. So norepinephrine, epinephrine. So this is going to bind to adrenergic receptors. And these effects are going to be longer lasting than acetylcholine. Adrenergic receptors are metabotropic receptors, so they're those G-coupled protein receptors. And we have ones that are going to be excitatory. We also have some that are inhibitory. So excitatory, we're going to be excitatory in the heart because we're going to increase muscle contraction of the heart. In the iris to allow dilation, the blood vessels for constriction, and then contraction of the digestive sphincters to kind of slow that process down. And then inhibitory, right, that's where we're going to be inhibiting in the bronchioles to allow dilation in the liver for glycogenolysis, to break that glycogen down to increase the blood glucose levels. Now there are different types of medications that target these. So adrenergic antagonists are going to block epinephrine and norepinephrine. So like metoprolol, that's going to help reduce blood pressure. And then adrenergic agonists, these are going to mimic. So like albuterol. So remember, if we look back, right, if we inhibit these, or if we bind with the inhibitory receptors, the adrenergic receptors in the lungs, right? So if norepinephrine binds with those receptors in the lungs, then we get dilation, which is going to be easier to breathe. And so albuterol, right, which is used for asthma. In asthma, you have constriction of the bronchioles, and so albuterol can be used like an inhaler to counteract that, to dilate the bronchioles, right? And then phenylephrine, this is a vasoconstrictor and decongestant, right? That again is an agonist, right? It's going to mimic norepinephrine. The other side are the cholinergic. So these are the ones releasing acetylcholine, and we have the nicotinic and the muscarinic receptors, right? So nicotinic is going to be excitatory, muscarinic can be excitation or inhibition, depends. We find these muscarinic receptors in like cardiac muscle to lower the heart rate. We also find them in the smooth muscle and glands for bronchoconstriction. We find them in blood vessels for vasodilation, for motility in the GI tract, and for secretion in a lot of glands. So some medications that, or drugs, I should say, that target this, so like anticholinergics, these are ones that block acetylcholine because they're anticholinergics like atropine. And then cholinergic agonists, these are going to mimic acetylcholine, and this includes things like nicotine. So here are our different ones. Remember the ionotropic? These are the neurotransmitter receptors that are just like that ligand-gated channel. The neurotransmitter binds and it opens up the channel. Versus the metabotropic, we have the G protein coupled receptor, where the G protein acts as a go-between between the receptor and the channel itself. So autonomic responses get triggered by the hypothalamus, or they're part of an autonomic nervous system reflex. Somatic responses, that's going to come from the cerebral cortex, right, or part of a somatic reflex. So autonomic, we think hypothalamus and autonomic reflexes. Somatic, we think cerebral cortex. The way I like to try to remember is somatic are things you're thinking about, and you use your cerebral cortex to think, right? Autonomic uses the hypothalamus, which is kind of the little bit of the caveman part of your brain, right? And so it's handling things that are a little bit more primitive, a little bit simpler in terms of overall like cognition and whatnot. So it makes sense the automatic things that are just like baseline, basic, keep you alive would come from that part of your brain. The effector organs that are autonomic are going to include smooth muscle, cardiac muscle, glands, right? A lot of things that are involuntary, because your skeletal muscle and the things that are voluntarily controlled are going to be controlled by somatic motor neurons, not autonomic motor neurons. So autonomic motor neurons, they're going to stimulate or inhibit their effector organs. It just depends on the organ. It depends on the neurotransmitter receptor that's there. Somatic motor neurons are only going to go for skeletal muscle. When it comes to autonomic neurotransmitters, we have a couple options. It can be acetylcholine or norepinephrine, but somatic is only going to be acetylcholine. When it comes to where we find those ganglia, where the two neurons meet, we see those ganglia in like the head, neck, abdomen, and right along the spinal cord for autonomic. But somatic, right, we don't necessarily have that ganglion just hanging out there. They're going to actually, the somatic motor neurons are going to extend all the way into the central nervous system. So there's a slight difference too in the physical arrangement of these neurons. Even though they're both motor neurons, they're handling different sides, right? Autonomic is handling automatic things. Somatic is going to be handling voluntary things, and so autonomic, we meet up in the ganglia. Somatic, it actually extends all the way into the central nervous system. So here, like we see, here are these ganglia, right? This is where we're connecting that first to the second neurons. So this is automatic. Whereas over here, right, we don't see those ganglia, right? We don't see those ganglia. So a little bit of a difference, right? A little bit of a difference between these two in terms of arrangement.